Aim high, shoot far, aim for the moon. If you miss, you'll hit a star.
Hello, everyone, and welcome to Better Together, sharing our lupus stories. I'm Sarita Pollinare, fellow Lupi, mental health consultant, and lupus ambassador. Chanel Gabriel is away on special assignment and will be back with us next week. I'm your host for this evening, along with our medical host, double board certified internist and rheumatologist, Dr. Michaela Baylard. Hello, Dr. Michaela. How are you doing this evening?
Hi, Sarita. I'm doing great. How are you doing?
I'm doing well. Thank you so much for asking.
So, I'm excited for tonight's show because it's a really interesting topic. It's a topic I have lots of discussions with my patients about, not just my lupus patients. And this is women planning families and planning to have a family. So, I always get this question. It comes up with patients, my girlfriends, we're always talking about when is the right time. Is that something that comes up with you?
Absolutely. It comes up in support groups. It's something that even comes up in my personal life. There are a lot of concerns and fears, especially when you're talking about lupus and starting a family or becoming pregnant. And there's a lot of, misinformation out there, a lot of things that keeps us from, doing some of those things.
Yeah. So when especially we're talking about pregnancy and lupus, we want to get some facts tonight because there's been so much misinformation about lupus and pregnancy, and really to talk about some of the positive pieces around this. So what I will say is that this is something in the past, as I mentioned, that has really been misunderstood, and people have been told not to get pregnant with lupus. So I think that tonight, hopefully, we start to break down some of those misconceptions because although there are risks for everyone during pregnancy, especially women with lupus, there's very real ways that people can have normal and healthy pregnancies.
I totally understand what you're saying. And to me, this is so frustrating. It's emotionally triggering. It's something that, you don't really know where to go or who to turn to or who to talk to because it's something that's very personal. It's something that you typically just discuss with a partner and, you just kind of go for it. But, unfortunately, when you have lupus, it's one of these things where sometimes a lot of people have to get involved. I have so many friends and like I said, people in my own support group who they have questions about getting pregnant and just how lupus is going to affect that, if lupus is going to affect their pregnancy and if it's even worth it.
Yeah, I mean, I think what's really exciting is that we know a lot more now from research and studies. We do have really positive ways to treat people during pregnancy. And I think we're just doing a better job in general diagnosing lupus, and primary care physicians diagnosing lupus, OBGYNs treating lupus. So much has changed with the awareness that's changed in the medical community and the lupus community in general. um, I really think that as I work with people like you and our other guests who are going to be on the show later today, we know how much of a difference patient advocates make. We really know that advocates for lupus want data-driven facts and not just the tradition of what's been done before, but how are we getting to that evidence-based medicine and why. So, advocating for yourself as a patient and researching the data and facts about solutions and treatments is so critical. And for myself as a physician, I really know that one of the best ways to get this data is from patients participating in trials that gives us that information. So I just have to make a plug here that if you are interested in finding out more about not only what clinical trials are, but if you would be someone who could help this data and be a part of it, to please go to biogentriallink.com. And you can see that at the bottom of the screen. The link is Biogen, BIOGEN, triallink.com.
Thank you so much for that, Dr. Michaela. And speaking about some of the guests that we have tonight, I am so excited for our first guest, who is Dr. Dwivedi. She's a cardiovascular disease physician, co-author of the article "Lupus and Pregnancy: 10 things that women who have lupus should know about pregnancy." And like I said, I just think it's something that's super important to really discuss and talk about and have people, understand, so that all of those fears can kind of subside when they're talking about, their pregnancy, and if it's going to be something that is going to be problematic for them, in the future because of their lupus.
It's so true, Sarita. It can be a scary place. And I think we can hopefully help our viewers see that really knowing the facts can change that. I really encourage my patients to have a cardiologist on board as a part of that medical team as they're approaching lupus and pregnancy if there are any concerns, because it's always helpful to have more people in that team to discuss what the best next step is and to get those real facts.
Absolutely,
So,
I concur with you.
so we want to bring Dr. Betty in because we have all of these questions. I know our viewers have questions, so we'll have her join us.
Hi,
Hello,
Dr.
Dr.
Baird.
Betty.
Hi, Sarita. Great to be on this show with all of you. And, I'm excited to be discussing a topic that is obviously close to all of our hearts.
Mhm.
And, it's very important to, like you just mentioned, to raise awareness and bring the true facts to our audience as well. So, looking forward to this.
I just have to ask, because you're a cardiologist, how did you get involved in thinking about lupus and pregnancy so much?
Yeah, so this is actually, I did research in at the Hospital for Special Surgery as a medical student,
Mhm.
where I was enrolling patients in a long-term prospective clinical trial, whereby we were seeing if modifying their risk factors and counseling patients to modify, their cholesterol, their high blood pressure, everything that leads to complications in lupus and heart disease,
Mhm.
because there is a big overlap if it changes outcomes over time. And that's sort of where my mentor at that time was a rheumatologist, Dr.
Mm.
Erkin.
Yeah.
So, and I was actually very surprised as a medical student to learn that the highest, risk of morbidity and mortality in lupus patients is because of cardiac conditions. And, I always
Mhm.
wanted to be a cardiologist. So I thought it was a great interface of, different disciplines, but at the end of the day, treating the patient as a whole.
That's such an important fact, and I don't think, everyone makes that connection that heart health can be really impacted by inflammation. Can you talk more about that?
Yeah, I think it's a more recent discovery in the grand scheme of things that we're realizing, but a lot of patients with autoimmune disease are actually at a higher risk of developing what we call plaque or blockages in the arteries of the heart. Not only that, the inflammation can impact the muscle of the heart, so the ability of the heart to actually pump the blood to the rest of the body. So, we are becoming more cautious. We are becoming more aware of patients with autoimmune diseases and aggressively treating their cardiac risk factors to overall improve their long term outcomes.
I think that's so important for people to hear. And it's, I think, really important to understand what that means. Like, say you saw Sarita in the office, what would you be monitoring to really make sure her heart was healthy?
Yeah, so I think the basic risk factors are high blood pressure. How's your blood pressure doing? Your cholesterol. Obviously, the family history plays a part as well. But we also now have these newer diagnostic tools like a calcium score, let's say, which can pick up plaque in its nascent stages before it goes on to cause bad things like heart attacks or cardiac death. And then sonogram of the heart, which can look at the valves of your heart or the muscle of the heart, and catching sort of the disease process earlier on in the course, and being able to modify the long-term outcomes. That's important, and that's sort of what I do a lot with my patients in the office.
Yeah. Thank you for sharing that. And I think the hypertension piece is so important. We know that it's something we have to monitor in everyone, but especially we worry about in women who are pregnant. How is this important in lupus?
Yeah, so lupus patients in and of itself, because of the underlying physiology and the pathology of the disease, are at risk for developing high blood pressure. Now, even women who don't have lupus, what we see is that they are at a risk for higher outcomes, like diabetes and high blood pressure during pregnancy or in the short period just after pregnancy, which we call the postpartum phase. So, maybe if you are of a certain age or above, or if you have a condition like lupus, as a cardiologist, I'm going to make sure you're the healthiest going into your pregnancy
Hmm.
so that you're at a lower risk of developing these complications while you're in this, period of pregnancy, which overall is stressful for anybody, anybody, even a healthy person. The body is under a lot of stress because a lot of changes. So I think that that's sort of where the, sort of optimizing the risk factors before you become pregnant is very important.
Hmm.
Now, Dr. Dovedi, I have a personal question for myself as someone who is, a lupus warrior and has been dealing with lupus for, close to 6 to 7 years now. Is it possible for someone who has lupus to have a successful pregnancy? Is it possible for, us to carry full term, do the things that we want to do? Because we all have that dream. It's, one of my dreams, but it's something that I've been, very mindful and fearful of.
Yeah, that's a great question. And, I say absolutely. I think that, like Dr. Baird said, you need the best team by your side in order to ensure the best outcome. So, if obviously your rheumatologist is going to play a big role, but let's say you have high blood pressure or, an elevated blood pressure related to the lupus, then, we're going to make sure that your kidneys, your blood pressure, everything is treated beforehand before you're thinking about conceiving or becoming pregnant, to ensure a healthy baby and a healthy pregnancy as well. So unless there are some rare cases in which, because of your disease condition or advanced condition, it might be too high risk. But I would say most lupus patients, if they get the right care, can certainly go on to have normal pregnancies, and it's definitely a viable option for them.
Now, see, that's such a relief to hear because literally this has been a question that has been in the back of my mind for I don't even know how long. I remember the first time, I talked to someone else. They were like, well, you're going to have a hard time, carrying a baby. And if you want to get pregnant and all these things. And it was just like, oh my gosh, on top of having lupus, now I have to worry about, having a complicated pregnancy. And that is just so scary to hear,
Yeah.
on top of everything else that you have to deal with, with lupus. So I'm so glad that you're talking about this and that you're, letting it, be known to the lupus community that yes, this is something that, is achievable. It's something that you can do.
Yeah. And I also want to say that, yes, if you do have lupus, your risk for complications during pregnancy are higher. Often we see preterm birth, or, women develop something that we call preeclampsia, which is a high blood pressure. Your liver can get impacted. So, all the more reason that you are in constant touch with your doctor, and that you develop those relationships before becoming pregnant, so that, God forbid, if things go wrong, you have the right help and support to get you to the end of the pregnancy.
Now, Dr. Duvedi and Dr. Bayard, just for some of us who, don't know, because you mentioned the word preeclampsia,
Yeah.
can both of you kind of expand on like, what that is and how that's a risk to some of us?
Go ahead, Dr. Duvedi.
Sure. So, preeclampsia is basically a condition where the blood vessels that supply, blood to the placenta and overall your body's physiology manifests it with a high blood pressure. There can also be impact on your liver function, so the liver can get stressed out and become inflamed. And then also your blood counts can get deranged in extreme cases, whereby you may be at a higher risk for bleeding and your blood clotting sort of goes a little, awry, so to speak. So, that sort of overall is the overall complex. But lupus patients, some patients who are older in age while getting pregnant, they can certainly be at a higher risk. And if you have underlying conditions like high blood pressure, diabetes, that may also place you at a higher risk of developing preeclampsia. Dr. Baird?
Yeah, I was going to say this is the reason why I'm so crazy about blood pressure. And I think my patients like, why are you obsessing over this and looking at these numbers? But it's because we use the blood pressure as kind of an early sign to see if you could be at risk for preeclampsia. And if we can identify it early, we can often, make interventions that prevent some of those downstream symptoms that Dr. Duvety mentioned. Um, you brought up a really important point, and you said that an important part is having everything managed before your pregnancy. Can you speak about that and why it's so important when you're planning?
Yeah. So, I always tell my patients the healthier you go into your pregnancy, the healthier you and your baby are gonna come out of it. So,
Mhm,
for lupus patients, especially, it's recommended to have at least 6 months from your last flare, because this period kind of, the studies have shown that if you go in further away from your flare, you're less likely to have complications during pregnancy as well. Similarly, with blood pressure, with blood sugar, and also just being on the right medications before,
mhm,
because some medications for blood pressure or lupus or diabetes are contraindicated in pregnancy.
mhm,
So, and especially in the beginning stages of pregnancy, when the organs are developing and the baby's very, very prone to developing, congenital anomalies, as we call it, or birth defects, you don't want to be on any of those medications. So you got to make sure you're on the right medications, your risk factors are well controlled, and that you have those established relationships with your doctors.
Yeah, it's such a good point. I have to state here that there are some medications that we actually encourage and keep people on while they're pregnant. And I think that's a really important point because I think we often believe that we have to stop everything. And you could probably speak more to that, Dr. Duvety.
Yeah, so I think, if let's say, like, for example, steroids are commonly used, in lupus patients. So certainly for the right patient, that may be continued. If you have high blood pressure, the what we call the beta blockers are usually the safest medication to use in pregnancy, for blood pressure control, versus if you're on something called lisinopril or losartan, those we're definitely going to stop before you go into, your phase of conception. And then the other thing is also your kidneys. Don't forget your kidneys, because your heart's very closely related to your kidneys. And when you're pregnant, your kidneys are also under stress and they're working overtime. So, some people, a lot of patients with lupus may have abnormal kidney function before becoming pregnant. So,
Mhm,
we also got to make sure that, with controlling the blood pressure, the kidneys are also happy before you become pregnant. So,
mhm.
based on sort of what you're on, we may continue it, we may change it, but it's just always important to check with your doctor.
So, Rita, is there something particular about your own experience with lupus that makes you a little bit concerned about family planning or thinking about pregnancy?
Yeah, absolutely. I have so many questions because, like Dr. Dovetti said, there are medications that we're told, we can't take that medication once we're, trying to get pregnant, things like methotrexate or
Mhm,
things like, Plaquenil, how certain medications can, like Dr. Dovetti said, really throw your blood counts and things out of order. So it's very concerning. And I would love, actually, I have a couple questions. One of them is, are there any types of um, like medical terminology that we should be looking out for, like different words, like you guys were talking about high blood pressure, which is, hypertension, but is there anything else, like you Dr. Devetti mentioned preeclampsia, just kind of words like that that we should kind of look out for when we're doing our family planning, and also kind of minding our lupus journey?
So I would say, lupus flares are important. Obviously, that may be a common term, but still important to keep a lookout for. Something else we think of is gestational diabetes, which is basically, or gestational hypertension, which means like it got worse or it became manifest when you became pregnant. And then, from a cardiac standpoint, something called cardiomyopathy is also important. That's basically when either your pregnancy or the lupus inflammation in and of itself starts to impact the muscle of the heart or the ability of the heart to pump the blood to the rest of the body. Dr. Baird?
I think that the big flare is definitely huge, understanding that. I probably use the word proteinuria or urine analysis without even thinking about it, but part of what helps us identify someone who may be in later stages of preeclampsia is seeing protein in their urine. So we just often send urine and collect urine to check for that. So you may hear that term proteinuria, but it's a sign that your kidneys could be inflamed.
That's interesting because those are words that, even as a person who's, not doing family planning right now or not pregnant now, those are all things that, come up in my doctor's visits, having things like protein in your urine, or, having to wonder about just your blood pressure. My blood pressure, sometimes it's up, sometimes it's down, so I
Mhm.
am constantly trying to make sure that I'm staying this, level of homeostasis, like what is normal, what's not normal, like.
Mhm.
And that's why, I think it's really important to talk about this, because when you're just dealing with lupus, that's one layer of the piece, and then when you're adding pregnancy on top of that, it can just be really, really scary. One of the other questions that I had is, can your pregnancy make your lupus worse?
So,
So sorry, go
go.
ahead, Dr. Baird.
I was just going to say that it goes back to what state you go into your pregnancy in, and I'm sure Dr. Devetti can add to that.
No, absolutely. That's exactly what I was going to say. The further away you are from your flare, the healthier you are, the better your risk factors like blood pressure, sugar are controlled. Your kidneys, the health of your kidneys matters a lot. So the better that is, the less. But pregnancy in and of itself doesn't increase your risk for lupus. That's what the studies have shown. But if you're not healthy going in, you're more likely to have a lupus flare.
And it's important, and we really talk a lot about your state before your pregnancy, because if you're having less flares and they're more spaced out, that decreases our need of adding medications such as prednisone, which we could use, or steroids, but we want to make sure we try to avoid anything that's not needed. So this is another thing that always comes up, is why has someone put me on, aspirin at an early stage in my pregnancy? And can you talk a little bit about that, Dr. Davidi?
Sure. Yeah. So, pregnancy is like I've said a couple times before, it's a stress on your body. And, if you are high risk, which lupus patients are considered higher risk becoming pregnant, you can develop blood clots. And so that could be a potential complication. Right now, the gynecological guidelines say that pretty much anyone above 35 should, take a prophylactic baby aspirin. But certainly for lupus patients, we want to mitigate that risk of blood clots. So, prophylactically starting somebody on aspirin is beneficial. And some people worry about the bleeding risk, but overall the safety of the medication has, panned out pretty well. So when you compare the risk and the benefit, the benefit definitely is much larger.
And so, we're talking a lot about pregnancy and the woman who is pregnant, but what about the baby?
Yeah, so a lot of, like I said, a lot of lupus, women with lupus end up delivering healthy babies, but because of the disease state in and of itself, or if you develop high blood pressure or a heart condition, you may be at a risk for preterm delivery or a low birth weight baby. So I think that's why it's important to follow up with your obstetrician very closely, so that if they do see any signs of growth retardation, or any signs that the pregnancy is impacting the baby, we can act upon it immediately and hopefully improve the outcomes.
And I'm sure that our viewers are also interested in kind of how that impacts that postpartum period after delivery, and also thinking about breastfeeding and all of these important things after we have delivered.
Yeah. So, again, a lot of the medications do get transferred into your breast milk. So obviously it's important to talk to your doctor about, the safety of breastfeeding, like steroids above a certain dose, usually about 20 milligrams. You're recommended to sort of what we call pump and dump, meaning, waste the breast milk for the first 3 to 4 hours after you take the medication. So there are ways to get around it. Of course, breastfeeding is recommended by, the American Pediatric Society, and we all know that it's very healthy for the baby. But there may be certain instances where, if the baby's preterm and the mother's not lactating, or the baby's just not strong enough yet to, breastfeed, there's always alternative methods that we can use that overall don't really impact the long-term outcome of the baby.
So I have a quick question, Dr. Javetti. When we're talking about, the baby and how to kind of manage some of these things like taking medication and breastfeeding, can the baby be born with lupus, or how does that affect, the
Yeah.
baby's health, because we're talking about making sure that we're doing things like pumping and dumping, making sure that the baby's not being exposed to certain medications. What are kind of some of those effects, for the child itself, for the infant?
Yeah, so there are certain cases, because basically, the mother produces antibodies when you have lupus. So those antibodies can sometimes, impact the baby. And it's a condition what we call neonatal lupus, which is basically a baby's lupus. The good news is that even though, it might sound scary, it's short lasting, and it's transient, meaning that it doesn't, it's not impacting their life. So that is probably the most common thing we see, although in the grand scheme of things it's relatively rare.
Yeah, and I just have to say that as rheumatologists, we actually have a whole battery of screening tests to really check and see if someone is at high risk for that, so we can connect you early with a cardiologist. So it really is in the hands of your rheumatologist to pull those important team members in early on. But this has been so helpful, because I think that it's important to know that lupus is not something that's going to stop you from being pregnant. We know a lot about it now, and the best medications, the best monitoring to do. Are there any key points you want to leave with our viewers, Dr. Duvetti?
Yeah, I think the first thing I just want to emphasize is your body is a complete package. If one thing's not working well, usually the other things also get impacted. So, if your heart's not happy, your kidneys are not going to be happy, and your pregnancy is not going to be happy. So, it's important to sort of treat obviously the lupus, but also get the right help to mitigate the risk that lupus poses on your body in terms of cardiac disease, kidney disease. So, I think that's probably the most important thing. And the second thing I'd like to say is, find support. So, if you're planning to get pregnant, it's important to not just talk with your partner, but like with your family, like can the parents help out, because it is going to be a stressful time for you. And, we often see that new mothers don't have time to make it to doctor's appointments. But for lupus patients, it's so important to, be closely monitored. So seek help, find support. And, I think that those are the two main things I'd like to say.
That's a perfect segue to Sarita because we've just been talking about this.
Absolutely. Thank you so much, Dr. Duvetti. I really appreciate you being here and just explaining some of these things to us so that we have a better understanding of, what we can do, before pregnancy, during pregnancy, and after pregnancy to better prepare for, that child and making sure that, our lupus is in check and that, our medications, what we need to be doing. It's so helpful and it puts me at ease, to be honest. It really does because it makes me feel like, okay, this is something that it's possible, it's feasible, like I can do
Yeah,
this as long as I have the right team. So thank you so much again. We really appreciated
my
having
pleasure.
you. And then for our next guest, it's going to be a mother of two, and her pregnancy journey with lupus is bittersweet, unfortunately. Lydia Romero Johnson is a lupus warrior. She's a registered nurse and a health coach, helping fellow Lupies regain their confidence to live their happiest, healthiest lives, despite what life has thrown to them. Thank you so much for joining us, Lydia. How are you doing?
I'm doing well. Thank you so much for having me. And that was an amazing segment. And boy, like I was getting fired up in here. And I wish I had a segment like that many years ago before my journey happened, right? Like before I was in there as a person with lupus having babies.
So, what is your story, Lydia? Will you share with us a little bit?
Yeah, absolutely. So my story is as a young child, I started having some health issues. We didn't know exactly what that was. And the birth of my first son 20 years ago gave me a lupus diagnosis.
Wow.
So all of those challenges that I was having before ended up with, the lupus diagnosis. And his birth, the pregnancy was great, but labor and delivery, all heck broke loose.
So, you had this new diagnosis. You have a newborn. Does and I also want to mention Dr. Vetti's going to stay with us so that she can contribute to our conversation. But, is anything ringing true that we talked about in that period with the newborn?
Oh my gosh. Yeah. So like I said, all heck broke loose with my son. And so from that, like it just made the challenge of navigating the newborn journey so much more harder.
Mhm. Can you share with us a little bit about the pregnancy first, like how that pregnancy went?
Yeah, absolutely. So like I said, the pregnancy was good with Jace. So he's 20 years old. I was working at JC Penney back then. I was cleaning out fitting rooms, working full time, doing all of those things. We planned to get pregnant, so we knew we wanted to have the baby. But again, we didn't know specifically that I had lupus. And so um, it wasn't, like I said, till the labor and delivery that everything went bad. It ended up with an emergency C-section. It ended up with him being in the NICU, so the neonatal intensive care unit, for 2 weeks. It ended up with me being discharged from the hospital, um, advocating for myself, saying, something's not right. I don't feel well. I don't think I should go home. And them sending me home. The next morning, me being readmitted to the hospital for blood transfusion.
So, what were you experiencing? Were you feeling tired? Like, what didn't feel right?
Yeah, so I had low-grade fevers that kept coming up. So I thought, okay, maybe this is infection. I felt very, very tired. I felt I was definitely, like pale, like weak, and things like that. And I just didn't feel right. It was just like kind of a gut level, and also just kind of like intuitive feeling that something is not right here. And the next morning, I woke up with excruciating chest pain.
Yeah, I think that's a very important point because I always tell my patients, you know your body the best. So if something doesn't feel right, get it checked out. And I think you did the right thing. But, a lot of people, whether it's heart disease, pregnancy, keep thinking, oh, it'll probably get better, it'll probably go away. But just if something doesn't feel right, get it checked out sooner rather than later.
Yes, absolutely. And I wish they would have listened to me. And so that is a big piece in the autoimmune journey. I feel like, advocating for yourself is super important. And sometimes too, it's having, like you guys mentioned before, support, other family members, other people to help you advocate, especially if you're very weak or kind of out of it or things like that. Because it can be so tough.
As rheumatologists, we know an unfortunate statistic that it takes a long time to get that lupus diagnosis. Knowing what you know now, Lydia, were there signs earlier on?
Oh yeah, for sure. Like I said, at childhood, I had a combination of things such as rash, which was something sometimes certain areas, sometimes all over my body, extreme fatigue, joint pain, sometimes nausea and stomach issues as well. Sometimes I even remember times where I would tell my mom my chest hurt, and having to go and explore if there were cardiac issues and things like that. Lots of doctor visits as a young child, and then even through teenage years.
Lydia, what you're mentioning, it's so familiar. It's such a familiar story as someone who has lupus. And I love the point that you said about advocating for yourself. You had to advocate for yourself. And I think that that is so important because it's one of the things that I had to learn, as a lupus warrior myself, is that when I wasn't feeling good and I knew something was wrong, I had to speak up and I had to say, listen, something's not right.
Yes.
And Dr. Duavetti, you were talking about, when Lydia was saying how she was having the chest pain and, how important that was, that she spoke up. I can't tell you how many times I've ignored that,
Yeah.
and just, it's fine. It's whatever, it doesn't matter. So, I'm so glad that the two of you are like really kind of piggybacking off of each other and just letting us know, especially in the community, like these are things that are super serious, they need to be taken seriously, and that they're common. It's something that I've experienced. Lydia, you've experienced it. It's just it's really hard. It's something hard to talk about, but it's something that needs to be talked about. So Lydia, when you were talking about some of the things that you were experiencing, like some of the chest pain and joint pains and things like that, did you experience anything like that during your pregnancy as well?
So yeah, again for him for that pregnancy, I don't recall any lupus specific type of happenings. I do remember a little bit beforehand, like maybe a few months, one of the doctors mentioning I had high blood pressure. But that was pretty much it. And again, since there wasn't that diagnosis, they didn't consider me high risk factor, as a high risk patient. So, nothing else. I was eating fine. Like I said, I was working, all of those things. But it wasn't until after. And again, things were so bad to the point of the blood transfusion. I had special antibodies. They had to get the blood from somewhere else. It took longer to get the blood. And that was part of some of the autoimmune process. And then there was also my C-section wound opened up and there was an infection and there was a nurse in my home for 3 months. There was multiple antibiotics. There was other complications. It really was truly multi-layered and a long-term challenge, but I don't want to scare, I don't want to scare anyone out there. It was painful and challenging. Yes, it was. And I want to just say this too. I want to throw that mental health piece because I don't speak to that piece specifically to this pregnancy as much, but that combination of everything that I went through, there was definitely that postpartum depression that kicked in on top of that after all of those different challenges. So it was rough.
I'm so glad that you talked about, the fact that it was something that was challenging and it was something that, you had to go through as a lupus warrior. But I like the fact that you were saying, I'm not trying to scare anyone, because this isn't something that just, loopy warriors go through. It's also something that's, common in pregnancy. And sometimes pregnancy can just be difficult, but it shouldn't be a reason to, make you shy away from getting pregnant. So long as you have that support, like you said, the mental health piece was super important, reaching out to family. And I know sometimes people don't necessarily have family that they can rely on for support, but there are support groups, for women who are pregnant and are also lupus warriors, and they're doing it, and they're not letting anything stop them. So I'm really glad that you talked about that and you brought that up. Now I know that we're talking about your first pregnancy, but can you kind of let us know, like, what happened during your second pregnancy? Was it the same thing? Was it scary, or was it easier? Sometimes women, they say, oh, my second pregnancy was nothing like compared to my first pregnancy. So what was that like?
Yeah. So I'm so glad that you're asking me. And so with that, we knew that I had lupus. So we were already, I was classified as a high risk patient. So I had a lot more eyes on me. There was actual preconceptual counseling beforehand. So that preparation, that being put on a prenatal vitamin, that, looking at labs thoroughly to see kind of what is active, what's going on, what antibodies are present, because certain antibodies can produce higher risk outcomes, such as at one point they did think that I had antiphospholipid syndrome for my second son. And so they put me on heparin. And the cardiologist could speak to that more.
I was just about to ask, heparin, what? please, let us know.
I'm glad you brought that up because some lupus patients, like you said, can also have antiphospholipid syndrome. And these patients, as a subselection, are much higher risk for developing blood clots, for developing high blood pressure, also for having miscarriages, preterm labor. So overall complication rate does go up. And to avoid, most people will do baby aspirin for prophylaxis, but because your risk is so much higher with antiphospholipid antibody syndrome, that typically you need the big guns of the blood thinners. We will like we call it that, like the heparin, which is an IV medication. So for sure, I think that it's important to recognize these things beforehand.
Yeah.
You also mentioned something else, Lydia, preconception counseling. So what was that?
Yeah. So that was, again, in the literature that you see now, and just overall, when you're talking to your OBGYN, they kind of encourage and recommend, 6 months before you plan on becoming pregnant, come and talk to us. We will kind of, again, see where things are, have a baseline, start the prenatals. So it's kind of having those conversations, gathering more history so that they're aware of what this could look like. Another piece too, for me, knowing I had lupus, that guidance to a perinatologist, which is a specialist who helps kind of explore a bit more deeply some of the risks that you have for you and for baby, to help support you as well. So I had the perinatologist on board for the second. I had more of those, visits for ultrasounds and checkups, just so much more along the way.
Now, I wanted to ask really quick because, you're throwing a lot of terms out and different things that, some of us aren't too familiar with, especially when it comes to pregnancy. How did you find some of these people to, help you transition in your second one? Because it sounds like your second pregnancy went a lot better. And that's obviously because you knew you had lupus. So what were those resources like, and how did you go about finding them?
Yeah. So, okay, it's a couple of things. One, I'm a researcher, like that's just my natural default. So kind of doing some of my research, and then also, being better equipped to then advocate for myself when I was with the OBGYN, and, to really clarify, because let me tell you, that first go was so intense that I really had to ensure, because I was scared. I was like, I'm not doing this again ever. Like, this isn't happening. But once I kind of got through some of that and then learned more and then knew I had a good team, I really felt supported by my medical team and with some of the research and things like that. So it was the research that I did, advocating for them, and then us working together on that.
That's amazing.
So as you went through that second pregnancy and you hit that postpartum period, can you tell us a little bit more about how that shifted?
Yeah, so that's a good question. I just want to add this too. So even though I was very much a lot more prepared for the second one, and I had a lot more support, we did still have a complication. He was born, they had to take him 6 weeks early. So he was premature, and he did end up in the NICU. Now, my journey on the healing process and all of that was much better. He was taken out, though, in part of something that was happening with my body, which was elevated liver enzymes. So my liver started to kind of act up, and I was very itchy. So I had cholecystitis, I think that's what they call it. But I was very, very itchy, and I was turning a little yellow and things like that. So they had to take him. So they took him. He spent 3 weeks in the NICU. And then that process after, once we got him home, of course, because it's hard having a baby in the NICU.
Definitely.
But my body was definitely a lot more resilient, a lot stronger. I was just in a much better place compared to that postpartum period, the first go, for sure.
So I want to, give you an opportunity to talk a little bit about what your own work is now, Lydia, because I think that this was pivotal in you doing your current work.
Yes, absolutely. So I'm a holistic health and life coach and also a registered nurse, but that holistic health and life coach piece, absolutely, my pregnancies, the lupus journey, all of that has inspired me and motivated me to live my own happier and healthier life. But when you have two little kids, right, thinking back to those days when they were little guys, it was tough. It was tough. And so with flares, with pain, with fatigue, with all of these things, it's like, I have to figure out how to help myself get better. And so my oldest son ended up getting diagnosed on the autism spectrum around age 8. And so that also, I'm like, I have to advocate for myself, but I also have to advocate for him. And so that's where about 12 years ago, I started with lifestyle modifications to help with that healing journey. And so once I knew that that was making a profound difference on my health and life and even my family, I went ahead and said, I need to help other people with this.
Yeah.
Thank you so much for answering that. And I just have one quick question, because you were talking about, how you help other people. Is there any advice that you would give, us fellow loopy warriors, about pregnancy, and just, something really quick that we can just kind of stick onto and just be like, hey, we can do it. She did it. We can do it.
Mm-hmm. Yeah. So, I mean, I'll be honest, when Dr. Dravetti was talking, again, it was just firing me up and getting me so inspired and so many different things. I'm like, wanted to share on, but I wrote little notes. And one thing that I think kind of, I want to speak on, and that she mentioned that I want to give to you guys is, she said something about the complete package, right? So kind of, to me, that's back in that holistic approach. And so, really it is, I think, that, foundation of the value of making sure that you're checking in with yourself, that you're good. If there's something that you feel that's not good, whether it's an emotional, a mental, a physical, please address it. Please address it. Please seek to learn more and advocate for yourself. And because again, the autoimmune journey, can be challenging, and sometimes it does take longer to get clarity on things, but keep addressing it.
Thank you so much, Lydia, for sharing that. And Dr. Dravetti, thank you so much as well for being here and talking to us and just giving us, the full package of, pregnancy and lupus, the things that we can do to prepare before, during, and after. Lydia, thank you so much for sharing your journey. And Dr. Dravetti, thank you so much for giving us the steps to take so that we can be better prepared,
Thank you so
for being
much.
pregnant with
Yeah, thank you
lupus.
for
You're
having me on
welcome.
the show. And I think it's so important to raise awareness, not just about pregnancy, but the heart issues, the autoimmune issues in pregnancy. So I think this is a great platform, and I'm glad I could contribute.
We love having you here. I'm not done with my questions for Lydia. I had one more question, because we often, don't talk about the partners in this experience. Could
Yeah.
you mind mentioning anything about that, Lydia?
Yeah. So again, because of how things went with the first one, it was very tough, rough for all of us, really. But it was like a complete curveball, we were blindsided. So it was really rough for my husband, and that journey. It was so vulnerable. I want to say that, because you think you're going in to have a baby and it's going to be happy and all of these different things. And then you get stuck with this emergent situation. Anytime you hear emergency C-section and baby in NICU, that's scary.
Yeah. Yeah.
And then, I'm the one who's basically literally, I remember just feeling to the point of I surrender. Like there's nothing I can do here and now. And so him having to learn to, navigate through that. So he definitely did. He stepped up. And of course I had other family and friends helping and supporting, but I'm sure, that was tough. It
Yeah.
was. And he said it was absolutely something that was scary. And, when I talk about potential of possible future, sometimes look, because Janet Jackson was 50, who knows what's possible now.
Hey, that's right.
So he looks at me
Baby
like,
number
what?
3.
Yeah. And so, just to say that again, too, with age and everything else, like there's more advancement, there's more education, there's more information. Just make sure that you guys talk to your doctors, your rheumatologist, your specialist, your cardiologist, all of those things, and get a clear picture.
Yes, thank you. And I'm sorry, I just had to ask that one last piece. I think that the theme, and you probably agree, Sarita, has been speaking up, and that your body, and especially in these new health journeys, whether it's pregnancy or a newborn, speaking up and asking your provider about things when they don't feel right. I think that's a really great takeaway.
Absolutely, I concur. Advocacy is key. And I have definitely learned that when it comes to, pregnancy and lupus.
Yeah. So I just want to say thank you again, Lydia, for sharing, the good and the bad of your experience, for Dr. Devetti from sharing your time from your busy schedule to give us all the facts, because we have to break down these misconceptions. And I think if you take anything away from tonight is that you can be pregnant with lupus.
Yeah.
So if you guys want to check out more from Better Together, remember to look for us on Facebook, YouTube, Instagram. Please keep posting your comments, reaching out, sharing. We love seeing all the conversation. Sarita, thank you so much for joining us. You've been such a fun co-host. This has been great. We both want to thank Biogen and remind you, if you are interested in additional information on lupus and clinical trials, please to go to biogentriallink.com, as you can see below, BIOGEN triallink.com. And Sarita, if there's anything you want to share or close, especially as your expertise in mental health, we'd love to hear it.
Absolutely. So again, thank you all for joining us. And I just want to say congratulations. Congratulations on everyone's lupus journey to family planning, if this is your first pregnancy or a continuation of your family. This is such an exciting time in your life. And I want to remind you that you are strong and capable of navigating this journey. You're a warrior and everyone is cheering for you. We are all cheering for you every step of the way. Remember that you are not alone. There are so many women who have had successful pregnancies and managed their lupus while being pregnant and had healthy babies. And as we learned, with the right care and support, you can do it too. So thank you so much for joining this webinar. And I hope everyone enjoyed this health note. I hope it was helpful, and wishing you all the best for a healthy pregnancy and a healthy baby.
Thank you, Biogen. We'll see you next week. Please join us for our next webinar, which is 2 lupus warriors living their best lives. And I think that's a great way to sum up so much of the Better Together conversation we've been having. So good night and have a great night.
Good night, everyone.